And today we have Dr. Opeyemi Lamikanra. So she is a board certified orthopedic surgeon who's going to come and talk to us about a lot of the hand conditions that a lot of women face during pregnancy. And so thank you so much, Dr. Yemi, for joining us on the show. If you
Thank you,
can
Dr.
just,
Bendy.
you are so welcome. If you can just go ahead and introduce yourself to our listeners and just tell everybody about who you are and what you do.
All right. Thank you for having me. It is a pleasure being on the show. So I'm Dr. Yemi Lamikanra. I am a board certified orthopedic hand surgeon. So that means that you do your orthopedic surgery residency, take your
Mhm.
ortho boards, and then you kind of take another kind of test and review of your cases in order to get hand certification. I practice in Atlanta, Georgia, and I
Yay.
cover, yes, a. So the anatomy that I cover is from the fingertips to the midshaft humerus or the arm. I do everything from nerves, tendons, broken bones, all of that stuff. And I've been in practice for about 8 years now. I'm a wife, mom of two, so I've had those pregnancy and postpartum experiences. My
Mhm.
daughter is 1.5, my son is 3.5. So we're active.
Oh, I love that. I so love that. I think it's super important to have clinicians who've been where you are. And so knowing that
Mhm.
you've been through the postpartum period, you've been through the pregnancy, and so you get it, you understand what it is to be a mom and have a lot of these conditions. And so when you speak to your patients,
Absolutely.
you're able to come from that lens for sure.
Yes.
So
Yes.
I think that's awesome for sure.
Absolutely.
So I do want to just go into why I think what we're doing here is important. One of the things when you contacted me on Instagram, I was
Yeah.
like, oh my gosh, I am so happy because I remember one of the things that I struggled with throughout my pregnancy and in my postpartum period was bilateral carpal tunnel. And the way it hit me was like just the degree of pain, the numbness I was
Hmm.
experiencing,
Hmm.
and it was a lot of different causes, and trying to figure out how to get relief it was really stressful because I had to be able to still take care of my kid, wash the dishes, do my daily things.
Hmm.
And honestly, I somehow managed to get through, but I know there's a lot of women who are listening to this show today who are probably stuck with some type of hand pain, finger pain, and are
Yes.
looking for answers. So this is why I really felt like it was super important to have you on here so we can break it down for our moms.
Absolutely. Carpal tunnel is one of the most common, it's one of the most common hand conditions, but particularly with pregnancy and the postpartum period. Just to kind of back up, carpal tunnel is pressure on the nerve in the wrist
Mm,
as it's passing into the fingers. So you get the numb tingles, kind of that feeling like you have to shake out your hand,
mm,
wakes you up from sleep at night, kind of just that feeling like, the feeling when your foot falls asleep, you get it in your
yep.
hand. And so it the hormonal shifts, the pressure shifts in the carpal tunnel lead to this numbness and tingling. And so the first step really is just wearing a brace at night, a regular old wrist brace you can get
Mm,
over the counter, putting it on at night. Some people find that loosening up a bit
mm,
helps. Sometimes people say they feel like they have to put it a little tighter. But what that
mm-hmm.
does is it kind of gives the wrist some rest overnight and allows you, hopefully, during the day to have less symptoms. So, my personal experience with it, I started to have carpal tunnel with my first pregnancy, kind of near the end, but I just went up a glove size. I was fine. My
Mm.
second one, though, I had it postpartum very
Interesting.
badly. It just kind of spiked in those first few weeks after,
Mm,
and it changed the way I talk about it. So, I used to say like numbness, burning pain, but now I describe like a prickly sensation because that was more what
hmm.
I felt like electrical shocks almost on my fingertips. And so I was wearing the brace, trying to do that first line step.
Mm. Well, I remember, similar discomfort. And one of the things that one of my aunts, I think, told me was like, I don't know if it's like actually true, if there's some benefit there, but I do tell my patients this sometimes, but I used B6 and
Mhm.
capsaicin cream. And I don't know what the mechanism behind it, but I would take some capsaicin cream, which is like cayenne pepper
Yeah.
type, and I would rub it on my wrist every day, and I would take a B vitamin and then put my splints. And actually my
Hmm.
wrist splints when I go to bed. And I don't know what did it or the combination of all of it, but honestly, it did provide a lot of relief and I
Good.
managed to get through that. So,
Good. Yeah. I don't have a lot of evidence on B6 and capsaicin, but
hmm.
capsaicin is used in hand in general. I think it kind of stimulates blood flow to the area. Like it's one of those things that you can just put on. And then in terms of B6, I remember taking it for kind of that nausea symptoms, but I don't remember it
Yes.
for
Yes.
but the B vitamins and nerves tend to go hand in hand.
They go
So
together. So
yeah,
it's no harm. No
it may
harm.
not be so terrible.
No harm. Oh man. So what happens if you don't get relief? What
Hmm.
is the long-term effects? Like what is if I don't treat my carpal tunnel, what is a
Hmm.
natural course? What's going to happen to my hands? Are they going to fall off?
That's a good
What's
question. Well, so it varies slightly with pregnancy and outside of that peripartum period.
hmm.
So if you are kind of if you develop carpal tunnel during pregnancy, it
hmm.
has been shown to start to resolve at about 6 weeks postpartum. And
Okay.
so most people, the vast majority of people will get some relief about within that first 6 weeks after delivery. That if you do kind of continue to have symptoms, you definitely need to see somebody because it can progress to a
Mm,
point where you end up needing a carpal tunnel release. The long-term effects of carpal tunnel syndrome in general can be things like just decreased sensation in the fingertips, muscle wasting in the thumb. But these are really like long term chronic symptoms. These are not
mm,
necessarily like you have carpal tunnel syndrome for a month and you're going to develop something scary.
got you.
So it's more of
Got
a
you.
long-term thing. And there are other treatment options. So if the bracing isn't working, I usually
hmm.
also introduce nerve glide exercises, and you can just Google carpal tunnel exercises. There's just stretches you can do that kind of
Okay.
help with the nerve. And then there are you can get a carpal tunnel injection depending on how bad it is. And that's
Okay.
a steroid injection.
Okay. How do you know if you are at risk for get carpal tunnel? Is there any
Mhm.
particular patients who get it, or is it just kind of one of those random things that if you're a mom, this is something that you should look out for after giving birth or during pregnancy?
Yeah, it's carpal tunnel is more prevalent in diabetics and any sort of hormonal shifts. Pregnancy is one of those. You can get it in different conditions that would increase just kind of pressure in the carpal tunnel. Amyloidosis is one of the more uncommon, but
Oh,
one of the
interesting.
things that can. A lot of times we just don't know. You question if like certain carpal tunnels are smaller than others and those type of
Mm,
things, but we don't necessarily know.
interesting. So unfortunate, one of those other things that we have to look forward to when
I
we
know.
get something else.
Exactly, exactly.
Something else to go on to
One
our
more thing
journey.
in the host of conditions that we get in pregnancy.
Lovely, lovely. Well, speaking of other things that can come, let's talk about some
Mhm.
other hand conditions that one can get instead of
Absolutely.
carpal tunnel. One of them that I'd love to kind of break down a little bit is Quervain's, right?
Hmm.
And I don't know if that's the best way to say it because I never get these medical terms right. But is it
I,
Quervain's? Is it
so
right?
some say dequervain and some say
Oh.
dequervain. I honestly pop it back and forth between the two of them. I guess we'd have to ask him
Hmm.
ourselves what his preferred
If if
pronunciation is.
if he is still alive.
Oh no, I'm sure
So
he's long transitioned.
oh man.
But yes, it's a very common. So it used to be called, and sometimes still is called, like new mommy's wrist. I treat
Mm,
it outside of mommy's too. But essentially, what that is it's a tendonitis of the wrist. On the thumb side of the wrist, the tendon is running mhm, underneath
yep.
the band, and so that essentially causes like inflammation, irritation. People feel it kind of when they move the wrist towards the pinky side. There's
Mm,
kind of a stretch pain or just kind of moving with the thumb. Again, more common in diabetics, pregnant women get it, postpartum
mm,
women get it. A lot of times it resolves really well with an injection. With carpal
mm,
tunnel, when I get an injection, I actually usually expect it to return. In the
mm.
majority of patients, carpal tunnel comes back with an injection. But if you're miserable, you're not sleeping, those type of things, it can be very
Mm.
helpful. But for Quervain, I find that, well, not I find, the research has shown
Mm,
that almost 80% of people with one injection get better, cure it, goodbye.
oh my
And
God.
so it's usually if people are having a lot of pain, then we start with an injection. And then for like a second injection, if it continues.
Okay. Well, that seems pretty straightforward
Yeah.
because I'm just thinking about just women having to face a lot of this discomfort and trying to balance the duties at home and
Hmm.
probably feeling like, oh, this is just another thing that I have to do. And then knowing like it's a
Yes.
quick fix. They just have to call up a hand surgeon.
No, really and truly. And this is why I talk about these things because, like, you will get women who are suffering and not knowing who
Hmm.
to call or answer. And I mean, a lot of OBs, thankfully, will know to refer to a hand surgeon.
Refer.
But if you don't even bring it up in your visit, you may not realize that there is a possible solution to your issues.
Yeah.
We don't. So, one thing I always tell this is the way I counsel my patients. If you are actively pregnant or breastfeeding women also have the same concern. When it comes to things like steroid injections, we don't have great science that shows, a steroid injection causes this amount of risk because we just don't do those studies in pregnant women and breastfeeding women.
Mm,
But steroids generally are felt to be safe in that amount. And the amount that we're giving is so little that overall they're felt to be safe. I had a steroid injection because I developed a trigger thumb, went right away.
mm,
I was very thankful, but just I don't necessarily have the data and the science to back me, but most kind of the medical community in general tend to see
mm.
it as a reasonable solution if somebody's miserable. It wouldn't be my first line,
Yeah.
but it's something to consider if
Consider.
like while pregnant.
I love that you said that because I think a lot of what women are concerned about, right, is if they go to a doctor, they're going to have to take medication, they're going to have
Hmm.
a surgery.
Hmm.
And so when they're struggling with a lot of these things, they're thinking, well, this is just a normal part of the course, a normal part of pregnancy, postpartum. I'm not going to mention it because it's just another thing. But that's why we do this. That's why I'm doing this podcast, right, is to highlight
Absolutely.
these conditions because you don't have to sit at home on this and look at that like a literally a quick fix. An injection
Yeah.
can take away your pain and can honestly improve your quality of life and help you enjoy your baby, enjoy that time picking them up, lifting them up without
Hmm.
pain,
Hmm.
without
Hmm.
pain.
Yeah.
So yeah, so we talked about carpal tunnel, we talked about the Quervains, and I want to kind of hit that last one that a lot of women suffer with, which you just talked about your experience, which
Yes.
is trigger finger. Tell us a little
Yes,
bit
trigger finger,
more.
this weird condition.
Very odd.
It is. So it's another tendonitis. So you get the tendonitis along the wrist for Quervain. It's a tendonitis of the fingers. You can get it in any of the fingers, thumb through small finger.
Mm,
And again, it's basically the tendon runs underneath a band. Think of it like a belt going through a belt loop, and one of the
mm,
loops is too tight. So you get friction and rubbing and clicking. So many women will have a finger that gets stuck and they're not able to actively extend it. So it just kind of clicks every time they're moving the finger. So what you can start with is just wrapping kind of this middle joint here. That can keep it from getting stuck overnight. So usually it's overnight. So I'll wrap with like a 1 inch Coban or even just a band-aid around that joint so that they're not waking
oh,
up with a finger that's like stuck and locked and then you have that morning pop. If that's not working after, a little bit, then you can an injection. And an injection can be a cure with trigger thumb or trigger finger also. So we would do up to two. And then if the second one isn't working, then we'd consider doing surgery for it. Again,
oh, surgery. Oh.
yeah, I know. Pregnancy, timing, things like that, always a
Oh my
factor.
God.
But the trigger finger release can actually be done under local only. And
Oh,
so the majority of my trigger finger releases I do under local only. So it's kind of like going to the dentist. You don't have to stop eating before,
wow.
slower risk. I'm injecting numbing medication into the area, doing the surgery, stitching back up, and putting you into a bandage. I have not had to do one in a pregnant woman, but just kind of,
Mm,
talking about what the process is like.
okay. I love to hear it. Love it. What advice coming from a mom? You're a mom. You've been through this before.
Yes.
How can moms juggle just the aches and pains of hand disorders with motherhood? Like, what advice would you
Yes.
give them?
It depends on when they're occurring. I think The one that I can kind of speak to a little bit is actually I could speak to both during and after.
Mm,
But during, I think for me, I elected to get the injection into my trigger thumb because I'm a surgeon. I use my hands. I need
mm,
my hands to be in peak form because my patients need them to be in peak form. And so for me, I had to be the patient
mm,
and listen to kind of the science and what I tell my patients and actually trust another hand surgeon to do my injection for me.
mm,
And so I recognize that trust that women have to have in their doctor.
mm,
And I would counsel you to go to a doctor and find one that you trust to help
mm,
guide you through these kind of nuances because it's true. It's a very real concern. Like I'm pregnant, I'm breastfeeding. I worry about medications and things that I put into my body. And can you talk to me about those things? Can we have this
mm.
discussion? Maybe not able to give all of the science, but at least understand the nuances and the
Understand
factors
it.
that are going into the decision making. And then also, I think the same applies in the postpartum period. For me, I found that like even just holding my daughter in different positions made my
Mm,
wrists feel better. Sleeping in certain positions made it feel better. And so thankfully at that 6 week mark, things started to clear up. And I was like, oh,
mm,
thanks. So again, I don't know that I would wait the whole 6 weeks before seeing somebody,
mm.
but just kind of having that knowledge can help women feel a little bit better as you're recovering.
Okay. How did you navigate the conversations with your husband about helping the baby and just kind of
Hmm.
dividing labor, knowing that your hands were affected? How did that
Yeah.
conversation go, and how would you advise women to have that conversations with their partner? Like, listen, I can't do this, and I need you to step up in this way.
Yeah, I'm very transparent with him. If there is anything, sometimes I just tell him, like, I'm not feeling myself. Like, I don't know what it
Mm,
is, but I'm just not feeling myself today. And
mm,
that's enough of a communication to just be like, I'm a little off. It's not really you. I mean, it
mm.
may be, but I don't know what it is right now.
Those hormones, you don't know if
You
it's
know, I have
him.
no idea what's going on, but I know I'm not feeling myself
Yeah.
right now. So just kind of keeping those lines of communication open. I would tell him when my hand was really hurting or things like if I needed him to pick up the baby, I just needed to do my stretches and those type of things. He's very supportive, kind of there to jump in as needed. So
Mm.
that was very helpful as we went through. Our daughter was also colicky, so
Oh, mercy.
yeah, we had many nights of past the baby.
Ooh, I know all about that. The only picture I have right now is me doing this at 3 in the morning,
All night.
all
I'm
night.
sorry, baby. I'm sorry. It's gonna be
Oh
okay.
my gosh.
But she's
That's
my champion
probably
sleeper now. So I always
you just a little initiation and
exactly. But yeah, I think communication and also communicating when they can be helpful. I think that
mm,
is helpful too, because I mean, we don't even know what it feels like to be postpartum. Like they don't know what it feels
no.
like. And so
Yeah.
communicating that aspect of it, just kind of this feels weird. This is how you can help is just tremendously helpful for them and you.
I'm glad. I think conversations are super important as women, as we are navigating these different things with our body. And I
Mhm.
always want to highlight that like, how do you have that conversation? Because I know it's a very real thing to live in a home, even though before you have the baby, you may not have talked about these
Mhm.
things and you feel like it is my duty to do this. And so when you're down, you don't know how to have that conversation. And
For
so
sure.
I wanted to take that time to just say, as a woman, if you're going through a lot of these hand conditions, if you feel down
Mhm.
and you're unable to lift baby, please do speak up, say
Mhm.
something, because the more you're continue to aggravate something that's already aggravated, you're just causing yourself pain,
Yeah.
and that's just not a really good experience
It
overall.
really isn't. Truly, truly.
Mm. Well, I always love to, hear if there's any new research about these conditions. I think about when you look at like postpartum depression and there's all this new science that's
Hmm.
coming out and hormonal stuff that's causing all of this. And is there a lot of research that they talk about in pregnant postpartum women that's now coming up that we need to just keep an eye out in terms of management and treatments?
I'd be I don't know of any that has come up
Mm,
specifically related to hand conditions, but I
mm.
would love to hear more about steroid injections because they are being given with some regularity for different conditions. And just kind of understanding if there is more research out there, or if somebody's looking at that, or
Yeah,
even if
yeah.
it's just a prospective or retrospective questionnaire type
Hmm.
study, that may actually be helpful for
Yeah.
counseling women.
For sure, because I think I had one of my patients noted that their milk supply went down, but it
Hmm.
wasn't an injection, it was with a measured dose pack. And
Interesting.
so, yeah, they were, it was a drastic change in their milk supply. And so
Uh,
that was something that they noticed. And so I was like, okay.
yeah,
And we gave it for
yeah.
some back pain, and it had an effect, but it quickly resolved after they finished the dose pack.
Hmm.
So,
That's really good to know. And
hmm
these are the conversations you should be having because that could be, scary for a woman if they
hmm
notice a decrease in milk supply, like, oh gosh, did I do something wrong? Or is this going to be a more permanent thing?
absolutely.
So
Absolutely.
that's actually very good to know. I'll keep that in mind for
Hmm.
patients.
Yes, yes.
Yes.
Well, I do want to talk a little bit about where you practice
Yeah.
and how people can find you because I'm
Yeah.
all about pointing people in the direction that they need to go. And so, if someone who's on this podcast listening, where can they find you to get the help that they need for their carpal tunnel or their trigger finger or their Quervains?
Absolutely. Well, the first place you can always find me is atlantahandsurgeon.com. That's my website. And I practice at Regenerative Ortho and Spine Institute in Atlanta. So I'm at the Stockbridge and the Buckhead offices in Atlanta. I'm also on Instagram, ATL Hand Surgeon,
Mhm.
LinkedIn, Opeyemi Lamikanra. Still working on that Facebook. It's not quite there.
Oh, well,
But the
it sounds like
easiest way
there's
to find
enough.
me. Yeah,
I said, it sounds like you have a lot of out there
I
already, which is good. You're already on social media, which is a really hard for some doctors to
Yes.
just get on
Oh,
social media. So,
it definitely. But I think getting on social media has given me just some insight into the fact that like women crave hearing more about what other
hmm
women are doing, how we're juggling this, how the kind of the dynamics of family and career work, the community that's out there, especially for like female physicians, was something
absolutely.
that I was kind of pleasantly surprised by with
Mm,
those kind of connections that you can make on social media. So that's been a real learning
absolutely.
experience for me this past like yearish
Yeah.
that have been kind of more visible. I say I've been under a rock for a time
Yes.
period before that.
But that visibility is important. I think
Hmm.
oftentimes you don't know how much your story can affect or help other people, can affect your patients. And so speaking about what you do is super important because like I said, I never knew that I needed physical therapy, pelvic floor physical therapy until another mom mentioned it. I never
Yes.
knew I could get lactation to my home. And so for
Hmm.
somebody listening to this episode right now, they probably didn't know there was any help for their carpal tunnel.
Gosh.
So the more visible you are, the more people have access to you. So I'm so grateful that you took the opportunity to come on here and
Oh,
just share with our moms about how they can get relief on in a very simple way too. So
yes. Yes. Truly, I think it's just having that information is empowering for women. And then you don't go searching and everyone thinks everything is carpal tunnel. And people will
exactly.
come in with like arthritis and be like, I think I have carpal tunnel. So just
Facts.
kind of letting people know what carpal tunnel is can, and also that it's not this like super scary thing can be
Mhm.
helpful for people too.
Absolutely. Well, please give us a word of wisdom for a mom if
Mhm.
you had advice to give, and just send us off with a word before we close out.
Oh, give yourself grace. And then give
Mm,
yourself more grace because there are just so many times when you are doing your best. You're trying to get everything done, and it just feels like it is not enough. And so,
Hmm.
especially in that first year, you kind of feel like you should be rocking it. You should be doing all
Yeah.
these things, and that you should be doing better than you are. Baby should be sleeping better. Baby should be eating better, should
Hmm.
be eating these nutritious meals and
Hmm.
worried about education and all of that. And even the second time around, I had to actively tell myself, remember, this first year is a grind. You know this. This is okay. Like
Hmm.
you're doing okay. So just talking yourself down, reminding yourself that you're putting in your all, it will be enough. You will
Absolutely.
be okay. Baby will
I
be
love
okay. Family
that.
will be okay. So
Hmm.
grace
I
and then
love
more
that.
grace.
And more grace, grace and more grace. Oh my goodness. Well, thank you so much for joining me on the
Absolutely. Thank you for
show.
having me. This was very nice.
Absolutely. Yay.
Yes. And I love, just thank you also for what you're doing because
You.
it is a space that I just feel more information, more knowledge, more
Hmm.
recognition is needed. I think emergency care in
Hmm.
general is a space that is somewhat underappreciated a lot of times, but then
Hmm.
even more so like, pregnant women,
Hmm.
postpartum women who have these questions and, it just you're filling a gap that I think is critical. So
Oh,
thank you
thank
also.
you. Thank you so much. Oh, well, that is the end of our show, and you all know where to find me if you have any
Yeah.
questions. And take care.
All right.
If you live in the Atlanta, Georgia area, I want you to consider working with EM Care to You. And this is my concierge medical company, and we offer comprehensive care for mothers postpartum. I started the company because I saw a need. I was taking care of so many postpartum moms that had a need, and I wanted to provide a solution for their problem. So at EM Care to You, we provide access to in-home lactation support, pelvic floor physical therapy, mental health support, and more. You can learn more about this at emcaretou.com. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.